Have you ever wondered why your hands feel chilly even when it's not cold outside? Or why some people have warmer hands than others? Is it just a matter of preference, or is there something more going on? Hello and welcome to Curiosity, where we explore fascinating and interesting topics about everything. Today we're going to talk about a common problem that many people experience: cold hands. In this episode, we'll dive into the science behind cold hands and what they can tell you about your health. Cold hands are often a sign that your body is trying to maintain its regular body temperature. When you're exposed to cold temperatures, your blood vessels constrict to reduce heat loss and preserve warmth for your vital organs. This means less blood flow to your extremities, such as your hands and feet, which makes them feel cold. This is a normal response that helps you survive in harsh environments. But what if your hands are always cold, even when it's warm outside? Always having cold hands could mean that there's a problem with your blood flow or the blood vessels in your hands. According to Mayo Clinic, some of the possible causes of cold hands include anemia, a condition in which you don't have enough healthy red blood cells to carry oxygen throughout your body. This can make you feel weak, pale, and cold. Buerger disease, a rare disorder that causes inflammation and blockage of the blood vessels in your hands and feet. This can lead to pain, ulcers, and gangrene. Diabetes, a chronic condition that affects how your body uses sugar for energy. High blood sugar levels can damage your nerves and blood vessels, causing poor circulation and numbness in your hands and feet. Lupus, an autoimmune disease that causes inflammation and damage to various organs and tissues. Lupus can affect your blood vessels and cause Raynaud's phenomenon. Raynaud's phenomenon, a condition that causes some areas of your body, usually your fingers and toes, to feel numb and cold in response to cold temperatures or stress. During a Raynaud's attack, the blood vessels in the affected areas narrow dramatically, reducing blood flow and turning them white, blue, or red. Scleroderma, another autoimmune disease that causes hardening and tightening of the skin and connective tissues. Scleroderma can affect your blood vessels and cause Raynaud's phenomenon as well. Some of these conditions are more serious than others, and some may require medical attention. If you have cold hands along with other symptoms, such as pain, swelling, color changes, ulcers, or infections, you should see a doctor as soon as possible. But what if you don't have any of these conditions? What if you just have naturally cold hands? Is there anything you can do to warm them up? Here are some tips from Livestrong. Dress warmly. Wear gloves, mittens, coats, sweaters, scarves, hats, socks, and other clothing items that can keep you cozy in cold weather. Exercise regularly. Physical activity can boost your blood circulation and metabolism, which can help you generate more heat and keep your hands warm. Massage your hands. Rubbing your hands together or using a hand massager can stimulate blood flow and relax your muscles. Use heat sources. Apply warm compresses, heating pads, or heaters to your hands when they feel cold. You can also hold a warm cup of tea or coffee for some extra warmth. Avoid triggers. Stay away from things that can cause your blood vessels to constrict, such as smoking, caffeine, alcohol, or stress. Cold hands are not always a cause for concern, but they can be a sign of something more serious. If you have persistent or severe cold hands, or if they interfere with your daily activities or quality of life, you should consult with your doctor. They can help you diagnose the underlying cause and recommend the best treatment for you. That's all for today's episode. Thank you for watching Curiosity. If you enjoyed this video, please like and subscribe for more content like this. And don't forget to share your thoughts and questions in the comments below. Until next time, stay curious.